Okay, guys. Yeah. I just want to share with you something that happened today. Like NEET-PG is over and counseling is going on, right? So today evening in my college, I got to meet my batchmate, right? He told me that he had joined MS General Surgery as first year PG. And he also told, I got PG after 20 years, right? So UG we entered in the year of 2002. And இப்போ அவர் வந்து PG had got an MS General Surgery. The happy thing about, he was in service, government service, and he entered PG now. The happy thing is that, yeah, he wanted MS General Surgery. And all the while, he kept trying, right? So he didn't lose hope. He kept trying till he achieved what he wanted, right? So it was nice to hear from him and to meet him today. Yes. So with that, I just want to tell you a word: never ever lose hope. Fix your target or your passion on something. Keep your options broad, right? And work hard every day. Definitely your hard work will be recognized one day. Yes? So what are we going to do in head and neck? This is a very interesting part of head and neck. Pharynx and nasal cavity. And then I just want you to revise upper limb with you. In another 2 months, your juniors, today NMC order came, right? They'll be entering in November 15th, and NMC has given the schedule for them. Yes. Yeah. So next month, you'll be seeing your juniors and they'll be starting general anatomy, upper limb. Yes. So you should know upper limb, lower limb thorough better than them, right? Yes. So yeah, this is an interesting part of head and neck, pharynx and nasal cavity. Because next year when you go for your first clinicals, when you attend your ENT posting, only when you know the basic anatomy, you'll be able to understand the clinical anatomy, right? Okay. Yeah, the second session of it, I want to revise with you upper limb important MCQs. Okay. So with discussion. Yeah. Okay. I just put a cadaveric image. Where do you think is the pharynx here? Yes. That is the pharynx here. You can see the palate here, right? This is the hard palate. This is the soft palate. Yes. So what do you see below the soft palate is oral cavity, right? And this is the nasal septum. Where is the pharynx now? Yeah, this is your thyroid cartilage. So this is the trachea. So this should be the larynx above, right? The trachea is here and the larynx. Where is the pharynx? I'll take a highlighter for you and I'll highlight that area. This area that you see here, yes, this is the region of pharynx. Anyone can guess what is the length of pharynx? Yes, you can just chuma tell whatever numbers you feel like. What do you think is the length of the larynx? Yes? Yes, Prajit, Shudaroli, Tamil Selvan is there? Yeah? You can just make a guess. You can enter in the chat box. What do you think is the length of the pharynx? Questions keka kudadada. Am I audible? Yeah? I don't get to see any text message in the chat box. Come on. Chat is disabled. Okay, why? Yes, Shrivashni, very good. Yeah. Chat. Okay. Yes, Shrivashni, you're right. The pharynx measures 12 to 14 centimeter in length. Yes. Okay. Yeah. The pharynx, please make a note of it. 12 to 14 centimeter in length. Hello, sir. Hello. Ma'am. Chat. Yeah, guys, I've told them to see the chat settings. Okay. So 12 to 14 centimeter in length. Very good. Yeah. So where does it extend from? Where to where do you want to call it as the pharynx? From, this is the skull, right? From the base of skull up to, can you tell me what is this cartilage? The only cartilage that surrounds the laryngeal cavity, that's the cricoid. All the other cartilage will be present only the anterior aspect or anterolateral aspect. Cricoid is the, yes, Shrivashni, very good, very good. Cricoid is the only cartilage. It is C-shaped, right? It is it entirely encircles the laryngeal cavity. What is the vertebral level of cricoid? Vertebral level of cricoid is important MCQ again. No, Shivanation, but happy that you tried. Yes, that is C6. Okay, very good, very good, very good. C6. Okay, this you should remember very well. It's an important landmark. Events at C6, right? Cricoid cartilage. So the extent of larynx is from base of skull to the lower border of cricoid cartilage. Fine. Now, what are the parts of pharynx? So I'm going to use 3 different highlighter colors here. The one that you see behind the nasal cavity, we are going to call it as nasopharynx, right? The one behind the oral cavity here, we'll call it as oropharynx, right? And the one behind the laryngeal cavity, yes, this area, we are going to call it as laryngopharynx. Okay, unfortunately, this picture got turned. Okay, so this is a very important specimen for your spotters. Okay, so they can keep epiglottis, tongue, soft palate, nasal septum, nasal cavity. It's the sagittal section of head and neck, right? So we saw the pharynx, its length, extent, and subdivisions. So in this picture, where do you think is the pharynx? Any idea? Where is the pharynx here? I'll again take the highlighter for you here. Okay, so this is the area. You can see the nasal cavity here. Yeah, okay, that's not the, yeah. One second. Yeah, I'll take the highlighter. You can tell me what is this bone shaded? This one? The bone that is in the midline. Can you tell me what is this? This is the omer that lies in the midline. Very good. And it forms the nasal septum, right? Omer bone. Okay. Yes, yes, Sivanation. Very good. Yeah. So where is the pharynx actually situated? Yes. Behind the nasal cavity, right? So this area, this is the area of a pharynx. Skull solnuna, this area. Right? Okay, so remember, there is one important bony landmark here. Can you see a raised area here? This is called the pharyngeal tubercle. Pharyngeal tubercle, yes, Prajit, okay, where the median raphe of pharynx will come and get attached. This is also again pharynx, yes, but how do you seeing it? You're seeing from the posterior aspect. Here, can you identify the 3 subdivisions of pharynx? Yeah. So can you see the omer here? Can you see this? This is the omer. Yes, in the midline. What do you see in the lateral wall of the nose? Can you see some shelf-like projection? Yeah. What are they called? They are called the concha, right? How many concha is there? Yes, Sivanation. How many concha is there? Very good. Idla MCQ, which one is an independent bone? Superior concha, middle concha, inferior nasal concha. Which one? Which one is an independent bone? Is again an MCQ. The inferior nasal concha. Like omer, the inferior nasal concha is an independent bone, right? So this is the nasal cavity. So this area will be nasopharynx. Am I right? So this is the area of nasopharynx. Who's going to tell me now? What is this structure here? Yes, what is the structure pointed out here? This is the Can you see a small projection here? The uvula. Uvula. What is this? Very good, very good. That's the soft palate. Yeah. So this picture is very important. There's so much information in it. And we can't see it in the human being, right? Okay. It's very difficult to see in the cadaver also. Yeah. So this is soft palate. Yeah, with the uvula there. So what you see above the soft palate is nasopharynx. What you see below the soft palate will be oropharynx. Okay. Oropharynx, love. Who's going to tell me this? What do you think this is? Yes? Come on, tell me. There's no harm when you make a mistake at all, guys. It is a lymphoid tissue. Of course, it is a lymphoid tissue. What is this? What is this? Yes? You might be surprised if I tell you this is the tongue. The dorsal part of the tongue. Yeah? With the lingual tonsil. School la padichirkingla about Waldeye's ring? Part of the Waldeye's ring, the lingual tonsil, right? In the oropharynx, in the dorsal part of the tongue. What is this red color arrow pointing at in the sides of the oropharynx? Can you see something peeping out here? Yes. What is that? Yes. If you eat a lot of ice creams, you would have got that enlarged infection. What is that? Very good, Sivanation. That's the palatine tonsil. Right? So you have to identify the soft palate, nasopharynx above, oropharynx below. Right? Now, what is this structure? The leaf-shaped cartilage. The leaf-shaped cartilage of the larynx. What is this? Very good. That's the, epiglottis. Okay, yes, that's the laryngeal inlet. This space is laryngeal inlet. So this area that you see here, that will be the laryngopharynx. Okay, so these are the three subdivisions of pharynx: nasopharynx, oropharynx, laryngopharynx. Okay, so even in this image-based thing, you should be able to identify. Again, what is this? This is also pharynx. You get to see the muscles of pharynx. Okay. For example, this is the auditory tube. You can see a muscle going down. Yeah. This muscle is called the salpingopharyngeus. Yes, salpingo. What does the term salpinx mean? Abdomen la padichirukkom, right? Salpinx refers to any tube, fallopian tube, right? So this is the salpingopharyngeus. This is soft palate, and you see a muscle going from the soft palate downwards. This will be palatopharyngeus, right? And there's one more which is not seen here, the styloid process, coming from the styloid process, this muscle, stylopharyngeus. Okay, these are the three longitudinal muscles of larynx. Coming from the auditory tube side, salpingopharyngeus, from the soft palate, palatopharyngeus, and then from the styloid process, stylopharyngeus. Where are these three muscles going for insertion? Any idea? What cartilage is this? This is the, yes? Very good, Arjun. That's the thyroid cartilage, right? So it inserts into the thyroid. Okay, this is thyroid. Below that is the cricoid. It inserts into the posterior border of the lamina of thyroid cartilage. All the three muscles: salpingopharyngeus, stylopharyngeus, palatopharyngeus. There's one MCQ in this thing. Heard about this? Shrivashni, Pessavant's ridge. Where is it and what is the muscle contributing to it? Pessavant's ridge. Yes, just try make a guess. Even if you make a mistake, no, you'll remember it better, guys. Pessavant's ridge. Yeah, no idea. Okay, no harm. It is formed by these fibers of the palatopharyngeus. Okay, please make a note of it. Palatopharyngeus. I'll show you its location. Okay, Pessavant's ridge. It will be exactly, sorry, this area. Soft palate is anterior na in the இடத்துல. Okay, the junction between nasopharynx and oropharynx, that's called the pharyngeal isthmus. Very good, Shrivashni. The pharyngeal isthmus is between the posterior border of the soft palate and the Pessavant's ridge, which is formed by the fibers of palatopharyngeus. Okay, keep that in your mind. So these three are the longitudinal muscles of pharynx. Yeah, now we'll get to see the features of each pharynx. Okay, subdivisions. So nasopharynx, right? So you can tell me anteriorly what will be its relation related to the posterior nasal aperture. What is the other name for posterior nasal aperture? Anyone? Nasopharynx is situated behind the nasal cavity, right? Yeah, very good, Prajit. It's called the choana. Yes, yes. Okay, so anteriorly it will communicate with the nasal cavity through the choana. Yes, the roof and the posterior wall of nasopharynx is sort of sloping, formed by the sphenoid, by the occiput and C1 vertebra. Okay, that is the sphenoid. This one, this is occiput, and this one is the first cervical vertebra. We saw that the pharynx comes all the way from base of skull to C6, right? Okay, so nasopharynx or a posterior boundary by the base of the skull, the sphenoid, occiput and C1 vertebra. Okay, and what is there? Anterior, posterior, lateral. The lateral wall, we are going to see certain features. This picture is more clear, right? This is the area of nasopharynx. Yeah. So what are the features that you get to see in the nasopharynx lateral wall? Yes, some clinically important structures are there. What is this opening? Any idea? One. That is what is opening into the nasopharynx? What tube is opening into the nasopharynx? Very good, very good, very good, right? So that's the pharyngeal opening of auditory tube. I told you the inferior nasal concha is an independent bone. This opening is situated 1.25 centimeter behind the posterior end of inferior nasal concha. Okay, the tubal opening, pharyngeal opening. Yeah. So above this opening, there will be the mucosa will be elevated. Can you see here that bulge? That is called tubal elevation. And over the tubal elevation, there will be the lymphoid tissue. That is called tubal tonsil. And I told you from that elevation two muscles come. Yeah. The salpingopharyngeus and the salpingopalatine fold. And there's a depression behind the tubal elevation that is called the fossa of Rosenmuller. Okay, pharyngeal opening of auditory tube, the tubal elevation, the tubal tonsil, fossa of Rosenmuller, the two mucosal folds. Right? Yeah. Apart from this, can you see one lymphoid tissue here? Who's going to tell me? What is this lymphoid tissue that you see here? In the roof of the nasopharynx. It is bigger in children. It becomes smaller as you grow up, like the thymus. Very good, Prajit. Those are the adenoids. Yes, very good. The nasopharyngeal tonsil or the adenoids, right? Yeah. So what will happen if this becomes enlarged? There will be an obstruction to breathing and the baby has to keep the mouth open, right? Yes. So yeah, so this is the nasopharyngeal tonsil. Above that, sometimes you can see a mucus depression that will be called the pouch of Lashka. So all these words can be MCQs for you, right? Foes of Rosenmuller, pouch of Lashka. Now, in school, you would have learned about Waldeyer's ring. What are the components of Waldeyer's ring? Yes. So that's a ring of lymphoid tissue that surrounds the upper part of your respiratory and digestive tract. What are they? Can you tell me this? This is 1. This is 2. Yeah, this is 3. And this is 4. These are the components of Waldeyer's ring. Yes, tell me what is 1? The lymphoid tissue that is present in the dorsum of the tongue. What is it called? Yes. Lingual tonsil. Very good. What is 2? Yes. In the lateral wall of oropharynx. 2. Below the soft palate, right? Yes, very good. That's the palatine tonsil. What is 3? What is 3? Very good. That is the tubal tonsil. What is 4? Nasopharyngeal tonsil. So these are surrounding the respiratory upper part of your nasopharynx oral cavity and protecting the body from the invasions, right? The lymphoid tissue. They form the Waldeyer's ring. Yes. So when the adenoids become enlarged in children, yeah, so there is it's blockage of air entering the nose, right? Entering the respiratory tract. So the child has to keep the mouth open. Yeah, has to keep the mouth open for respiration, and that leads to loss of a lot of features called the adenoid phases. Yeah, so here, can you tell me what is this structure? Chocolate question. Yes, come on, tell me. What could this be? Very good. Okay. So whatever, if you get the concept, you'll be able to identify it in whatever image. Very good. That's the nasopharyngeal tonsil or the adenoid. So the roof of the, this is a better picture, I think. One more thing to add on this. In the roof of the nasopharynx, not only what are the things we saw? Nasopharyngeal tonsil. And then, yeah, I told you one mucosal rhesus, right? Pouch of Lashka. And sometimes, you know, the pituitary gland is developed from 2 sources. Is the embryology of pituitary gland over? The pituitary gland, adenohypophysis, develops from the ectoderm, right? Rathke's pouch. So the remnants of Rathke's pouch can also be seen in the nasopharynx. The neurohypophysis is from neuroectoderm. The adenohypophysis is from the ectoderm, surface ectoderm, right? Rathke's pouch. Yes? Yeah, who's going to tell me? Easy? Tell me the row and column. Which row, which column? Yeah, easy. Yes, come on. Now we'll move on to oropharynx, right? So oropharynx, what are the features? Before that, the junction between nasopharynx and oropharynx. What is that? Yes. What is the important function of this part? Whenever you eat or drink water, it shouldn't go into the nasopharynx, right? Pharynx is a common channel for food and air here. Okay. So what will happen when you're going to eat, or yeah, it's not epiglottis. When you eat or drink, what will happen? The soft palate, you can see the soft palate is hanging down, right? So this soft palate will move up and close this opening. This is called pharyngeal isthmus. வீட்ல சொல்லிருப்பாங்கல்ல, பேசும்போது சாப்பிடும்போது பேசாதீங்க, right? Yeah, because when you talk, the air is going to enter in, right? So yeah, so the closure of the pharyngeal isthmus is by anteriorly posterior border of soft palate and posteriorly by what component? I told you, one MCQ, right? Posteriorly, there is one ridge here. What is it called? Pessavant's ridge. What is the muscle forming it? Yes, what is the muscle forming Pessavant's ridge? Palatopharyngeus. Sivanesh, yes? Palatopharyngeus, yes, Shrivashni? Yeah. So now coming to oropharynx, tell me. Anteriorly, the oropharynx, it communicates with oral cavity via oropharyngeal isthmus. Okay. Posteriorly, it is related to C2, C3. Okay. What do you get to see in the lateral wall of oropharynx? One important essay question. That's the palatine tonsil. Okay. So can you identify the palatine tonsil here? Where is the palatine tonsil situated? Palatine tonsil is situated in which pharynx? Oropharynx, right? Which wall of the oropharynx? Lateral wall of oropharynx. Yes, that is called, yes, that is called tonsillar fossa. Tonsillar fossa. What are the boundaries of tonsillar fossa? Anteriorly, you see a mucosal fold here, right? What is this mucosal fold called? From the soft palate to the tongue. It's called, it's coming from the soft palate to the tongue. Very good, Arjun. That's the palatoglossus. Posteriorly, there's another mucosal fold going down, not to the tongue, but going down. What is that called? Palatopharyngeus. Very good, Arjun. Okay. What is the above? Superiorly related to soft palate. You can see the soft palate here. Soft palate. Inferiorly. What is it inferiorly related to? You see the tongue, right? The dorsum of the posterior most part of the tongue. These are the parts of tonsillar fossa. It's easy, no? But they will not ask this. Yes. Easy. What is more important, clinically, surgically important, is the lateral surface of the tonsillar fossa. Abdomen la padichirukmola, stomach bed. Okay. Here it's called the tonsillar bed. The lateral wall of the tonsillar fossa. What are the structures there? So here you see the tonsil, right? So this is the tonsil. Okay. After that, what you see here will be, yeah, there are few structures. Please make a note of it. Tonsil. So this will be medial surface of tonsil. This will be lateral surface of tonsil. That will be related to the loose areolar tissue. And the loose areolar tissue, there will be one important structure, the paratonsillar vein. Anyone can tell me what is the other name for paratonsillar vein? And MCQ la mati ketirukanga, even in NEET-PG entrance examination. The other name for paratonsillar vein is, yes, please note it if you don't know, external palatine vein. One of my students who completed first MBBS and he went for ENT postings, he asked me, ma'am, enna ma'am, the external palatine vein, what is that? ENT, that term only they are using. Okay, so remember, these both are same. Paratonsillar vein is otherwise called external palatine vein. So what are we talking about now? The lateral relations of the tonsil. So immediately there's a capsule. Outside the capsule, loose areolar tissue with the paratonsillar vein. And then two important muscles. Okay, here, you have the fascia there, the pharyngobasilar fascia. That is the outer serous coat of pharynx, pharyngobasilar fascia, and inner to that two muscles, superior constrictor muscle and stylopharyngeus. Please make a note of it. Superior constrictor muscle, stylopharyngeus. Then you have again another fascia, buccopharyngeal fascia. Okay, so the pharyngobasilar fascia is on the inner aspect of the muscle, that submucosa. Buccopharyngeal fascia lies outside the muscles, that is the serous layer. Okay, and then there are three arteries. Three arteries will be related to it. Facial artery, ascending, palatine artery. The internal carotid artery lies 2.5 centimeter behind. Please make a note of it. Three arteries are there. Okay, and also the glossopharyngeal nerve. Extensive, right? These are the frequently, idhula avlo MCQs irukku, right? So you have to definitely memorize the tonsillar bed structures. Okay, outside the tonsil, loose areolar tissue with the external palatine vein. And then you have two muscles sandwiched between the fascia, pharyngobasilar fascia and buccopharyngeal fascia nadula, superior constrictor muscle and stylopharyngeus. Yes, and then the three arteries, remember the glossopharyngeal nerve. Okay, diagram order tharova theriyano. Yes, now can you identify where is the palatine tonsil here? Easy. So this is the palatine tonsil. Can you tell me what is this? The part of Waldeyer's ring. What did we learn? Just now we learned, right? Very good. Okay, so different images also you should be able to figure it out. The lingual tonsil. Very good. Okay. Yes, Shrivashni. Now who's going to tell me what is this A? What is this B? What is A? What is B? Here also you see it. A is the anterior boundary of the tonsillar. Very good, Arjun. Yes, the anterior boundary of tonsillar fossa. What did we learn? Palatoglossus fold. Whenever the term fold is there, it means mucous membrane. Within that, you have the palatoglossus muscle. B, another posterior boundary of palatopharyngeus. The posterior boundary, right? Yes, Shrivashni. Yeah, the palatopharyngeus fold, which has the palatopharyngeus muscle. Right? Inga. Yes. Can we identify the same thing? Yeah. You can see make out the palatine tonsil. Yeah. So remember in future when you attend a lot of quiz program and all, there'll be a lot of image-based questions. NEET-PG, a lot of image-based questions will be that. Okay. So that's why I'm trying to show you maximum images. This is palatoglossus, pinadi palatopharyngeus. You can make out the lingual tonsil here. Yeah. Yes, I told you palatine tonsil is an important essay question. So location eludanu, yes, and the relations of it and arterial supply. Why is it very important? Okay, like you can see, like most of the children, they come to ENT OP. Tonda valikku, the tonsils irukku. Yeah, so it's a very common. You get to see many patients with enlarged tonsils. The blood supply, yes, there's a superior. This is the tonsil, right? Okay. The superior tonsillar artery is branched from the greater palatine artery. Superior tonsillar artery. Okay, because above the tonsil you have the palate. So greater palatine, lesser palatine arteries will be supplying the superior aspect of the tonsil. Okay. And then here from the anterior aspect, these are the anterior tonsillar branches from the lingual artery. Anteriorly, we have the tongue. So the lingual artery, the dorsal lingual branches, they supply the anterior aspect of the tonsil, palatine tonsil. They are called the anterior tonsillar arteries, right? And the posterior aspect of the tonsil, the posterior tonsillar arteries are branches from ascending palatine and facial artery. Okay. Anterior is from lingual, posterior is from ascending palatine and facial, superior is from the palatine. The important MCQ is the inferior tonsillar arteries. Inferior tonsillar artery is the main source of blood supply to the palatine tonsil. Where is it coming from? From the, yes, Shrivashni, from the facial artery. Okay. So this is the major source of blood supply to the tonsil. Inferior tonsillar artery from facial artery. While the facial artery lies in the neck and then only it goes to the face, right? So while it's in the neck in the digastric triangle, it gives the inferior tonsillar branch to supply the palatine tonsil. What about the venous drainage? This is about artery. Venous drainage. Yes, I told you a few minutes back the name of one vein. What is it? Paratonsillar vein. What is its other name? What is its other name? Come on. Very good, very good, very good. Yes, the external palatine vein. Okay. So the main venous drainage into the, and from here to the pterygoid venous fluxus. Yeah. Any idea what is a nerve supply? Nerve supply? Whenever you get tonsil, there'll be referred pain to the ear. What nerve forms the tympanic plexus in the middle ear cavity? The tympanic, very good. Okay. So the referred pain, tonsillitis, there'll be referred pain to ear. Okay. This is because the tonsil is innervated by the glossopharyngeal nerve. Okay. So they not only come with tonsil, enlarged tonsil, associated ear pain also. Yes, glossopharyngeal nerve. All this is MCQ. Artery MCQ, vein MCQ, nerve supply MCQ, lymph node is also MCQ. Any idea what is the principal lymph node of tonsil? The principal lymph node of tonsil is jugulodigastric. Very good, Bharati. The jugulodigastric node. Okay, the principal lymph node of tongue. Yeah, for tonsil it is jugulodigastric. For tongue, when does the lymph node play importance? In carcinoma, when there's an infection, right? The principal lymph node of the tongue is jugulo-omohyoid. Okay, very good, Bharati. Yes, Guru Charan. So please remember, this is again an MCQ. Okay, so a lot of MCQs in palatine tonsil region. This is the enlarged tonsil, right? Very frequent. It's a very common condition. அழகா வாயை திறக்க சொல்லி டார்ச் லைட் அடிச்சு பார்த்தாலே ஈஸியா தெரிஞ்சிரும். Enlarged tonsils. Yeah, as I told you, the glossopharyngeal nerve is responsible for referred ear pain because of its nerve supply. Yes, as I told you here, remember, we saw the palatine tonsil here in the lateral wall of oropharynx, right? Now, easy? Not at all difficult. Yes, very good, very good. Okay. Yeah, have you figured it out, guys? the position of the pupil here. Can you see? These two are adducted, the pupil, and this is sort of far away. Okay, minor difference. Yeah. Now coming to laryngopharynx, easy. So the laryngopharynx anteriorly. Tell me, so this is the region. Enga irukku laryngopharynx? This is the laryngopharynx, right? The lower border of cricoid. So what will be anterior relation? Anteriorly, it communicates with the larynx through means of the laryngeal inlet. Posteriorly, it will be related to C4, C5, C6 vertebra, cricoid, lower border of cricoid. Okay. Above, okay. Above will be upper border of epiglottis. Below, what happens below C6? It becomes continuous with the esophagus, right? Pharyngo-esophageal junction, isn't it? Okay. Now there's something interesting in the lateral wall of, yeah, okay, before that, laryngeal inlet. It's again an MCQ. What is laryngeal inlet? So can you see here, if I put anything here that will directly go into the larynx? Yes. So that's the laryngeal inlet. What are the borders of laryngeal inlet? Okay. Yeah. Anteriorly or in front by epiglottis, the upper border of epiglottis. Posteriorly, what do you think is here posteriorly? Any idea? That's the arytenoids, the arytenoid cartilage, the interarytenoid fold of mucous membrane. Okay, posteriorly the two arytenoids. And on sides, what is there in the sides? This mucosal fold that you see in the sides, any idea what is it called? Very good, Arjun. That's the epiglottic fold. Right? So these are the boundaries of laryngeal inlet. Epiglottis in front, interarytenoid mucous membrane behind, and on either sides by the epiglottic fold. Right? Yes, this is your MCQ part. It's a 5-mark question also. Pyriform fossa. Where does it lie? It lies in the laryngopharynx. That's why we are talking about it now. Where does it lie in the laryngopharynx? In the lateral wall of laryngopharynx. Where is it in this picture? Can you see the shallow area on either side? Like a buried, a depth one. That is the pyriform fossa. Okay. So what are the boundaries? Why is it interesting? Yeah. What is the other name for this? It is also called the burglar's fossa, right? Yeah, the burglar's fossa, the smuggler's fossa. So they can hide certain things there. Okay, in the olden days, they used to keep it as a hiding area and carry things. Yeah. Okay. So what are the boundaries of it? Yes. Medially we'll start. You know what is this there medially? What is this called? The epiglottic fold, right? Medially, epiglottic fold. Okay. Laterally, this is why many people forget. Laterally, any idea what is it? This is the thyroid cartilage, the inner aspect of the thyroid cartilage, the mucous membrane covering the, yes, the medial surface of lamina of thyroid cartilage. Okay, thyroid cartilage. What is that above? This one, this fold here above, it connects the larynx with the epiglottis. The epiglottis and the tongue. Above it is called the pharyngo. இதுவும் அடிக்கடி மறந்து போயிடுவாங்க. Pharyngo epiglottic fold. The epiglottis and the pharynx, or the tongue actually, the lateral glossoepiglottic fold. Pharyngo epiglottic fold. I'll repeat it again because a very important question. Medially epiglottic fold. Laterally, the mucosa covering the inner aspect of the lamina of thyroid cartilage. above by pharyngoepiglottic fold. Now, what is the content of this? Anyone? What is the structure traversing? Ischiorectofossa, we have learned, right? Something going through and through the fossa. What is it? Anyone? Yeah, here, okay. Ischiorectal fossa, you would have learned, right, in abdomen. Some structure is traversing through the fat of the ischiorectal fossa. What is it? Coming from the pudendal nerve and internal pudendal artery. Yes, someone? Inferior rectal vessels and nerve. Nyaporika. Guru, Chudaroli. Yes, Srivashni. Prajit. Are you there? Inferior rectal vessels and nerve. Okay, similar to that, the piriform fossa is traversed by internal laryngeal nerve and vessels. Okay, so this is entirely a sensory nerve that is going to supply the mucosa of the larynx above vocal fold. Yes. Okay. Yeah. So this I took from the, yeah, it is an article where a page, you can see the piriform fossa here. These are the vocal cords. You can make the white vocal cords there. So it's going to the larynx. Can you make with the tracheal cartilages there? Where is the piriform fossa here? It lies on either side, I told you. So this is the area of piriform fossa. What do you get to see here? Enna theriyudinga? Yes, anyone can guess? அதேதான் பெரியவங்க சொல்வாங்கல சாப்பிடும்போது பேசாதீங்க. Okay, don't laugh while eating and all. That's the chicken bone. Okay, it is an article. I just took this picture from an article from a journal where a patient presented with a chicken bone in the piriform, lodged in the piriform fossa. Luckily, it is in the piriform fossa. What would have happened if it enters the laryngeal cavity? Again, obstruction of breathing, choking, right? Then you have to do an emergency tracheostomy. Okay. Yes. Who's going to tell me? The Passavant's ridge, it lies over. Yes, very good, Bharati. Very good, very good. Yes, Arjun. Yeah. Oh. Yes, I've given only 3 options. This they ask frequently in your NEET-PG entrance examination. Okay, திருப்பி வேற மாதிரி question போடுவாங்க. Please make a note of it. The reactionary hemorrhage அப்படினா surgery முடிஞ்சு in the immediate post-operative period within 24 hours after surgery, right? Because of any injury to the external palatine vein or the paratonsillar vein. Okay. Muscle which contributes to the lateral wall of tonsillar bed. Very good. I told you 2 muscles, right? Superior constrictor and very good, very good. Stylopharyngeus. Fine? Yes. Yeah. So here, the muscles of pharynx, easy. We have already done it, okay? The longitudinal muscles. So before understanding the muscles, I want you to understand the layers of pharynx, okay? So in a white enna. What is the white thing that you see here? That's the pharynx is a tube, right? So nadula irukka the white vandu, that's the lumen through which the air or the food is going to pass through it. Second layer enna the lumen ku adutha you have the mucous membrane. And then third will be submucosa. And fourth will be the muscle layer. And the outermost will be the serosa or the adventitia, right? Yes. So here you see the lumen, the mucous membrane. Yes. What will be the mucous membrane? Epithelium in nasopharynx. Can one of you tell me? What is the epithelium in nasopharynx? What is the epithelium of the respiratory tract? Yes, Prajit. Respiratory epithelium ki innor per enna? In trachea. Histology. Yes. Pseudo stratified ciliated columnar epithelium, right? What will be the epithelium in the oropharynx? Yes, that you told me, right? Yeah, as the mouth oral cavity, it will be non-keratinized stratified squamous. Non-keratinized stratified squamous epithelium, isn't it? Laryngopharynx again, respiratory epithelium, similar to the larynx, right? Submucosa, I told you the name of submucosa. Lateral wall of tonsil. Tonsil bed bed sollumbodhu, what did I tell? The submucosa is called the MCQ. Please make a note of it. Pharyngobasilar fascia. Padicholla. Pharyngobasilar fascia, and then came the muscles, and then outer to it was the serosa was the buccopharyngeal fascia. Yes, so this other name you should definitely remember, okay? So pharyngobasilar fascia na submucosa. Buccopharyngeal fascia, that's the outermost covering for the muscle. Okay, so muscle, as I told you, important. They are arranged in 2 layers. You can remember this COIL. Outer circular, inner longitudinal. Okay. So this is the layers of pharynx. The lumen, mucous membrane, submucosa, muscle, and serosa. Yes, we have done the longitudinal muscles before. Can you tell me what is this muscle? The longitudinal muscles of the pharynx we did, right, at the starting of the lecture. Can you identify one? That is it's coming from salpinx, from the auditory tube, margins of the auditory tube. Very good, Arjun. That's the salpingopharyngeus. From the soft palate, I told you, palatopharyngeus. And this one coming here, stylopharyngeus. Right? These are the 3 longitudinal muscles. Ide picture la, I can show you the 3 constrictor muscles. Right? The outer circular muscles are the constrictor muscles. How many constrictor muscles are there? Constrictor muscles, how many are there? 3. What are they? Superior, middle, and inferior. Okay. So yes, I'll show you the 3 constrictor muscles here. This is the superior constrictor muscle. How am I telling this? This white color band that you see here, what is it called? That's the, anyone? That's the pterygomandibular raphe, from which the middle fibers of buccinator padikumbol padichirpomla, upper fibers from maxilla, lower fibers from mandible, and the middle fibers from pterygomandibular raphe. That same pterygomandibular raphe or a posterior aspect, origin of superior constrictor muscles. Okay. What bone is this? What is the name of this bone? That is the, very good, yeah, that is the hyoid. Okay, so this muscle that comes from the hyoid, that is the middle constrictor. Okay, and the last one, this is the thyroid, this is cricoid. So the muscle fiber coming from the thyroid part. Okay, this part will be the thyropharyngeus part, and this one will be the cricopharyngeus part of inferior constrictor. Easy, guys, easy, very easy. Okay, So inner longitudinal muscles, outer circular muscles. The inner longitudinal muscles are 3 in number: salpingopharyngeus, stylopharyngeus, and palatopharyngeus. Adhe mari outer circular muscles also 3 in number: superior constrictor, middle constrictor, inferior constrictor. Superior constrictor is coming from pterygomandibular raphe. Middle constrictor is coming from hyoid. Inferior constrictor is two part, from the thyroid and from cricoid. From the thyroid, we are going to call it as thyropharyngeus. From the cricoid, cricopharyngeus. Okay? Easy? Now, what happens to these constrictors? You saw the origin of it, right? And when you see it like a pot, within the pot, it will be arranged. All these come posteriorly and they insert into a midline raphe. Remember at the beginning of the lecture, I showed you the pharyngeal tubercle, right? The median raphe, the topmost part will insert into the pharyngeal tubercle. So here, this is the superior constrictor muscle. This is middle constrictor muscle. This was hyoid, right? This will be the thyropharyngeus part. This is cricopharyngeus. This is the esophagus. Okay. So either understand pannada, adutha important MCQ part nama understand pannalam. Okay so far? Okay. Again, here also I want you to identify the muscles. Yes? Yeah. Can you identify the longitudinal and the constrictor muscles here? Okay, try to identify the muscle here. Yeah, so the landmark here is, this is the pterygomandibular raphe, right? Ippa solunga, what is this muscle? Yes, come on, easy. From the pterygomandibular raphe, that is very good. That's the superior constrictor, right? What is this muscle then? Yes, easy. Just now I told you, that's the, very good. You got it. That's the concept, right? Buccinator. Avlaveda. Super. Okay. Yeah. Now, this is the hyoid, right? So this should be, yes, from the hyoid. Sorry, this one. These fibers going behind. This should be the middle constrictor. This is thyropharyngeus. This is cricopharyngeus part of inferior constrictor. Okay, now I want you to understand another important concept. Okay, so what is this structure? Can you tell me? The membrane connecting the hyoid and the thyroid. What is it called? Yes, it's called the, I'll take another different color. That's the thyrohyoid membrane. Yes, solli kuduthirupanga. What are the two structures piercing the thyrohyoid membrane? The thyrohyoid membrane is pierced by, yes. I told you two structures, yes, Chudar. Superior laryngeal vessels and internal laryngeal nerve. Okay. Yes, Gurucharan. Superior laryngeal vessels and internal laryngeal nerve. They pierce the thyrohyoid membrane. So, this is a question na. Name the structures that pass between middle constrictor and inferior constrictor. Because hyoid lend the origin the middle constrictor. Thyroid lend the origin the inferior constrictor, right? So these are the two structures present between middle constrictor and inferior constrictor, right? Now, tell me what is this? Sorry, here in the shaded area, can you see yellow color here? What I'm shading? What is that? What is that landmark? Come on, guys, waiting for your answer. Very good, very good, very good, right? That is the tracheoesophageal groove. Shri Vashni, can you tell me what is passing through that? The tracheoesophageal groove. Structures passing through it will be your divination. Yes, correct. One more. What is the artery accompanying it? Very good. Come on, tell me. Yes. The tracheoesophageal groove is traversed by inferior laryngeal artery and the recurrent laryngeal nerve. Yes, Chudar, inferior laryngeal artery is a branch of inferior thyroid artery. Okay. So this inferior thyroid artery will give an inferior laryngeal artery that will accompany the recurrent laryngeal nerve in the tracheoesophageal groove. So idhula question eppadi poduvanga structure that passes below the inferior constrictor. 2. Structure passing between the middle and inferior constrictor, superior laryngeal vessel and internal laryngeal nerve. I'm sorry, between the middle and inferior constrictor. Now, who's going to tell me the structure passing between superior constrictor and middle constrictor? Yes, from the same picture. Yeah, so this is superior constrictor, right? This is middle constrictor. So what is this muscle? Anyone? Yes, Divination. What is the muscle pointed here? It's coming from styloid process. Okay. Either stylo glossus. This one is the stylopharyngeus. So between the superior and the middle constrictor will be stylopharyngeus and the nerve which is going to supply it. Glossopharyngeal nerve. So this you should have in the tip of your fingers. Okay. So below the inferior constrictor, inferior laryngeal artery, recurrent laryngeal nerve. Between middle constrictor and inferior constrictor, at once remember the thyrohyoid membrane, pierced by the superior laryngeal vessels and internal laryngeal nerve. And then between middle constrictor and superior constrictor, stylopharyngeus and glossopharyngeal nerve. Now what is left is, yes, come on, the space above the superior constrictor. Can you see this area here? Any idea what is it called? It's given a name called the space above superior constrictor. It is called, Shri Vashni, are you there? What is it called? It's called the sinus of Morgagni. Yes, Arjun, sinus of Morgagni. It's not open. You can see it's closed by a membrane. Yeah. Yes, very good, Shri Vashni. It's closed by a membrane. This is the submucosa, which lies inner to the muscle, right? So what is it? It's the pharyngobasilar fascia. Pharyngobasilar fascia. Okay. The sinus of Morgagni is the space above the superior constrictor. It is closed by the pharyngobasilar fascia, and there are 4 structures going to pass through it. Okay, 4 structures will pass through it. Yes, easy. Can you find out? Someone tell me which is the correct one. Which is the odd one out? 5, 5, yeah. 1, 2, 3, 4, 5. Appa, thank you. I forgot really. Yes, very good, guys. Very good, very good, very good. Super. Sharia. Yes, all of you are very attentive. Okay. Now I'll finish this. Yes. So, எங்க மதுரை மக்களுக்கு தெரியும், what is this dish called? Any idea? Yeah, after coming to Madurai only, I know its name. It's called the pure vegetarian. What is it? Yeah. So the structure which passed through the sinus of Margagini above the superior constrictor will be levator belly palatine muscle, auditory tube. Okay, and then two arteries. Pharyngeal branch of ascending palatine artery. Very good. And then the branch coming from your external carotid artery. Do you remember the only medial branch? Ascending pharyngeal artery. Okay. If you are not comfortable with LAPA, you can keep another mnemonic, LEAP. Okay. So L is for levator belly palatine, E for eustachian tube or the auditory tube, A is for ascending pharyngeal artery, P is for pharyngeal branch of ascending palatine artery. Somehow remember it because these are frequently asked MCQs. Okay, நீங்க சொல்ல சொல்ல எழுதலாம். Come on, tell me. Below inferior constrictor, what are the two structures? Yes, Chudar? Recurrent laryngeal nerve, yes, and inferior laryngeal artery. Between middle constrictor and inferior constrictor, thyrohyoid membrane, right? Superior laryngeal vessels, and then, yes, very good, internal laryngeal nerve. Okay. Between superior constrictor and middle constrictor, stylopharyngeus muscle and the glossopharyngeal nerve, right? Above middle constrictor through the sinus of Morgagni, remember the leaf structures. Levator belly palatine, eustachian tube, ascending palatine, ascending pharyngeal artery, pharyngeal branch of ascending palatine artery. Okay. Now coming to the last part of pharynx lecture. Yes, just one important MCQ clinical part of it. Yeah. So what is a diverticulum? Yes. Mucosa. We saw that the layers of pharynx, right? Mucosa, submucosa, muscle, and serosa. Okay. Enna agum appadina? Sometimes when the pressure within the pharynx increases, this mucosa will bulge out through weakness in the wall and form pouches. They are called the pharyngeal diverticulum. There are three clinically important diverticulum. Zenker's diverticulum. Okay, the one here, Zenker's diverticulum. And then, yeah, Lammer's diverticulum. ஒரு வார்த்தை தான் எல்லாத்துக்கும் சொல்ல போறேன். And then Killian-Jamieson diverticulum. Killian-Jamieson diverticulum. So why these diverticulums are formed? When the pressure inside the pharynx increases. Why does the pressure inside the pharynx increase? Okay. So this thyropharyngeus part, you know, inferior constrictor has two parts, thyropharyngeus and cricopharyngeus. Thyropharyngeus action is to push the food. Okay. And cricopharyngeus has more of a constrictor action, like a sphincteric action. So when there's an incoordination between the two, okay, when both are going to contract, the pressure will increase and the mucosa is going to bulge out through weakness of the wall. This produces the Zenker's diverticulum or the Pulsion diverticulum. இதுதான் மூணுத்துலயும் ரொம்ப common frequent. Okay. So So the position of these two is important. Okay. So Zenkersum midline posterior aspect. In the posterior aspect, ladam paakalam. So this one here. Between where? Between the thyropharyngeus and cricopharyngeus. Between the thyropharyngeus and cricopharyngeus in the midline posteriorly. Okay. Lemur's diverticulum, you can remember one mnemonic. Zenker is, yeah, above the cricopharyngeal part, below the thyropharyngeus part. Lemur's is the lowest part, below the cricopharyngeus. It is between the cricopharyngeus. This one, can you see? This is the lemurs. This one here. Okay. That's the lowest part. You can see that below the cricopharyngeus, above the esophagus. Iduvum midline posterior. Okay. Midline posterior. The Killian Jamieson alone, and the sides you can see. Yeah. Its position. So image-based question, this will be helpful for identification. Okay. Anterolateral, into the lateral aspect of the pharynx. Okay. So, you know, WhatsApp ne taniya dictionary poda vendirukkom, right? So remember this alone, P, L, Z. So P stands for the diverticulum which are posterior. What are the two diverticulums which are posterior in the midline? Lemur and Zenkers. But their location differs. Zenkers above the cricopharyngeus. Zenkers. Lemurs is below cricopharyngeus. Okay. Guys, can we have a 5 minutes break and then continue with the upper limb MCQs? Yeah, this will I'll tell you. All the muscles of the pharynx are innervated by pharyngeal plexus. Pharyngeal plexus is contributed by 9th nerve, 10th nerve, 11th nerve, and sympathetics. Okay. What is the exception? Easy, right? Stylopharyngeus. Stylopharyngeus is innervated by, very good Arjun, 9th nerve. Pharyngobasilar fascia is a modification of submucosa. Pharyngeal muscle that contributes to tonsillar bed, superior constrictor and stylopharyngeus. Right? Yes, who's going to tell me this? Pharyngeal muscle contributing to the floor of carotid triangle. Carotid triangle essay question illa. Which pharyngeal muscle contributes to the floor of carotid triangle? Very good, very good, very good. Okay. Yes, very good, guys. You want a break? 5 minutes? Yes? Yes or no? Some response, guys. Yes, Guru Charan, Chudar, Prajit. Yeah, okay. We'll take a break and come. Guys, can we start? Yes? Okay. Thank you, Shrivashni. Okay. So actually, I have put 50 questions, but I'm not in a hurry to finish it. Okay. Because each of these MCQs is very, very important. So slowly I'll be revising it with you. Yeah. So which among the following is a hinge joint? Very good, very good, very good. What about others? Can you tell me? First carpo-metacarpal joint is an example of? Yes? Anyone? The first carpo-metacarpal joint of the thumb. What is it an example of? It's an example for 5-mark question. Upper limb. Yes, saddle type of synovial joint. There are 5 saddle type of synovial joints. I mean, under saddle type of synovial joint, there are only 5 in the human body. One, first carpo-metacarpal joint. Yes, in lower limb, calcaneocuboid. Guys, don't worry if you don't remember, okay? We are just revising, trying to recollect, reinforce, okay? Repeat it and trying to remember it, okay? Yes, the first carpo-metacarpal joint of the thumb in upper limb, in lower limb, calcaneocuboid joint, and the patellofemoral joint. One more in upper limb, the sternoclavicular joint. Sternoclavicular joint. Structure wise. And one within the ear, what is that? Between the incus and malleus, incado-medial joint. Okay. So totally how many saddle joints in the human body? 5. 2 in upper limb, 2 in lower limb, and 1 within the ear. Yes. So then what type of joint is the wrist joint? The wrist joint is an example for, yeah, it's an example for ellipsoid. Ellipsoid type of synovial joint. Okay. Okay, coming to the question, which among the following is an hinge joint? The answer is interphalangeal joint. What are the movements possible in your interphalangeal joint? Yes, flexion, extension, right? Yeah, flexion, extension. These are hinge joints, right? This one, a fall on the wrist in extension usually fractures which carpal bone? Try to make a guess. Even if you're wrong, no harm. It's not your radius and ulna. Look here, which carpal bone? A fall on the wrist in extension usually fractures the scaphoid. Okay, scaphoid. Yeah. So one thing that you should remember about the blood supply of the scaphoid is, if this is the scaphoid bone, this is the anterior aspect, this is the posterior aspect of it. The blood supply, the vessels reach the anterior aspect via the posterior aspect, from the back door to the front door. Okay, so whenever there is a fracture, this part will undergo avascular necrosis. Okay, this you should remember, avascular necrosis. False about pronation. Supination and pronation is an important 5-mark question that takes place in the forearm, right? Yeah. So you see, this is the radius and ulna. Yes, between the radius and ulna, supination takes place. So what is the option? The head of the radius spins with an annular ligament. Yes. The lower end of the radius, it rotates forward and medially. Radius is lateral. During pronation, it comes medial. Yes. Interosseous membrane is despiralized? No. Okay. During pronation only it gets spiralized. Of course, the power of supination is more stronger than that of pronation. Now, the MCQ, another MCQ related to this topic is, what are the muscles that cause supination and pronation? Who's going to tell me? What are the muscles that cause supination and pronation? Pronation is easy to remember, right? Yes, yes, children. Pronation is caused by pronator teres and pronator quadratus, right? Supination, there are two muscles. What are they? What are the two muscles causing supination? Easy by the name, right? Supinator, and very good as he told, biceps brachii. Okay, don't forget biceps brachii. The oval gap in the lower part of interosseous membrane transmits which vessel? If you remember, there is an extensor retinaculum. There will be compartments, right? First compartment, second compartment, third, and fourth. That is the clue. So it's going to pass through the fourth compartment. Which vessel? The oval gap in the lower part of the interosseous membrane transmits. Very good, very good, very good. Okay. Anterior interosseous vessels. Yes, very good. Okay. Yeah. So the structures passing through fourth compartment will be extensor, digitorum muscle tendons, extensor, indicis, posterior interosseous nerve, and anterior interosseous artery. So how does this anterior interosseous artery enters posterior compartment of forearm? Through this gap here. Okay. The oblique cord is a remnant of which muscle? What is oblique cord? Between the radius and ulna, right? The tuberosity of the radius and the tuberosity of ulna, you can see something connecting it. This is the oblique cord. What is it a remnant of? Yes, you want to give it a try? Yes, guys. One of the deep, I'll give one clue. It is the deep muscle of the forearm. How many deep muscles are there? There are three deep muscles in the forearm, right? What are they? Flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. This oblique cord is a remnant of flexor pollicis longus, which is also a unipennate muscle. Okay. Supracondylar fracture of humerus involves injury to? Yes. Supracondylar. Very good, very good, very good. Yes, very good, guys. So what are the nerves related to humerus? The one which is frequently involved will be the axillary nerve that winds around the surgical neck of humerus, isn't it? And then in the spiral groove, we have the radial nerve. And behind the medial epicondyle, that will be the ulnar nerve. Behind medial epicondyle. Okay. And above the condyles, both brachial artery and median nerve. These are the ones which are intimately related to humerus. Okay. So what is that abnormality you see here? This is showing you the fracture of surgical neck of humerus. So what will be the nerve involved? Yes, easy. Very good. That's the axillary nerve. Okay. So the question can be put in different part, even in case scenario or as a picture based image. Axillary nerve. Yes. What is A, B, and C? All this is showing some other shaft of humerus, right? Yeah. So if it is involving the spiral groove, that will be the radial nerve. This one typically shows the supracondylar above. These are the condyle region, the lower part of humerus, right? Supracondylar fracture of humerus involves two structures usually. The median nerve, because both are like lying close together in the cubital fossa, right? Median nerve and brachial artery. Okay. So this is an image of the cubital fossa. You can identify the brachial artery here, right? This is the brachial artery. So what will be this structure lying medial to it? This is medial, this is lateral. Yes, this will be median nerve, right? This is median nerve. You see the brachial artery. You can see the brachial artery dividing into, yeah, radial artery and ulnar artery, right? What is this then? That is the biceps tendon. And lateral to it, this is the radial nerve. What is the arrangement of structures in the cubital fossa from medial to lateral? M, B, B, R, right? To show you more clearly, yes. So this is the median nerve. This is the brachial artery. This is the biceps tendon. And this white one that you see here, that's the radial nerve. Is it clear? Median nerve, brachial artery, biceps tendon, radial nerve. Okay. What is this? Oakman's ischemic contracture. You can see the muscles, the forearm muscles all atrophied. So what happens in supracondylar fracture? Injury to the brachial artery. You know, the brachial artery is going to divide into radial artery, ulnar artery, and that is going to supply the forearm, right? So if there's no blood supply, the forearm muscles, they go for ischemia, right? And that will lead to fibrosis, atrophy of the muscles. It leads to the forearm muscles are flexor muscles, right? It leads to flexion deformity. This is called Oakman's ischemic contracture due to injury to brachial artery. Okay, whenever the blood supply is compromised, the muscles, right, they become fibrosed. This question. Another one, similar thing, wait. Okay, this one, abduction of shoulder joint is initiated by think once more. Yes, yeah. Abduction is initiated by supraspinatus. Okay. Whenever you sit and write your exam, right? That initial 15 degree of abduction, you can feel a pain in that area, in the upper part of the shoulder. Okay. The first 15 degree is by supraspinatus. Okay. 15 to 90 degrees by middle fibers of deltoid. 90 to 120 is by the lateral rotators of humerus, the muscles which are inserting into the greater tuberosity, remember? Infraspinatus, teres minor, 90 to 120 degree. 120 degree to 180 degree, the last completion, that is by trapezius. And part of the serratus anterior latissimus dorsi, okay? So 15 up to 15 degrees supraspinatus, 15 to 90 by middle fibers of deltoid, 90 to 120 the lateral rotators of humerus, and then overhead elevation by trapezius. Okay, should remember it always. Joint, I'll take separately. Yeah, this one, protraction of scapula is produced by mainly by the pectoralis major. What do you mean by protraction of scapula? Yeah. So that muscle is not here. Actually, the serratus anterior muscle. Okay. Serratus anterior muscle. It pulls it forward. Okay. Pulls the scapula away from the midline. Okay. That is protraction. Retraction is by the rhomboids. Acromioclavicular joint, easy. Example of, yeah, they frequently ask this. Okay, this is an important MCQ. The acromioclavicular joint is an example of plain synovial joint, right? This is easy. Yes, guys, are you there? I thought it's very easy, right? Yeah. The long thoracic nerve, nerve of Bell. Okay. So this they keep asking you frequently. This deformity is winging of scapula. The nerve involved is long thoracic nerve or nerve of Bell. Yes. The root value will tell of what is the cause of injury. Where does this nerve lies? Can you identify in this image? Yeah, which is long thoracic nerve? This one or this one? A or B? Yes. Very good, Sivanation. Yes. B is long thoracic nerve. Then what is A? Yes, Shrivashni. What is A then? Yes, you can see it accompanying the subscapular vessels. Remember, the axillary artery divided into 3 parts. From the 3rd part, you get the subscapular artery. What is the nerve accompanying it? No idea? That's the thoracodorsal nerve. Thoracodorsal nerve. Okay, from the posterior cord, the nerve to latissimus dorsi muscle. Yes, 6, 7, 8. Yeah. So when there is a surgery of the like carcinoma of the breast, we want to remove the mammary gland, mastectomy, or any lymph node clearance in the axilla that can injure the long thoracic nerve. So the case scenario, you'll have a clue, right? The muscle paralyzed will be serratus anterior, right? This is easy. Regimental badge of anesthesia is seen in case of injury to yes, yes, yeah. So where do they wear the badges? Regiment. Yes, the soldiers, they wear the badge over the This could be an image question, right? This area, yeah. So it is actually the upper lateral cutaneous nerve of arm. The sensation is lost in that area. And this is a branch of axillary nerve. Now, what I want you to tell me is lower lateral cutaneous nerve of arm is a branch of, yes, the lower lateral cutaneous nerve of arm is a branch of, yeah, very good. Okay, so please remember this very frequently asked question. So arm order, lateral aspect, upper part is by axillary nerve, lower part is by radial nerve. Okay, so axillary nerve injury, the upper lateral cutaneous nerve of arm. Okay, it's a branch of axillary nerve, and typically the sensation will be lost in that area. This is called regimental badge of anesthesia. Now, what are the two muscles innervated by axillary nerve? What are the two muscles innervated by axillary nerve? And deltoid, and what is the other muscle? Very good. Teres minor. Okay. So, you know, the deltoid is needed for abduction for the shoulder contour. That will lead to atrophy of the deltoid. So, this axillary nerve is very important. Yes. What is the other name for axillary nerve? It is also called the circumflux nerve, because it winds around the surgical neck of humerus. Circumflux nerve. I think its root value is C5, C6 from the posterior cord. Am I right? Posterior cord. Relation to humerus, it's going to wind around the surgical neck of humerus, right? And then it will pass through the upper quadrangular space, if you remember. Upper quadrangular space. Yeah. And then, yeah, motor component, deltoid and teres minor. Cutaneous component, I told you, upper lateral cutaneous nerve of arm. What is important, interesting MCQ related to the termination of axillary nerve? Yes, the nerve to teres minor, how does it end? It forms the, Shrivashni, the nerve to teres minor that forms the, very good, pseudoganglion. In lower limb, what is the similar nerve which forms the pseudoganglion? Only three nerves we talk about pseudoganglion. One is nerve to teres minor, and the other one also in upper limb, posterior interosseous nerve, and in the lower limb, deep peroneal nerve. Yes, very good. The deep peroneal nerve. These are the three nerves, okay, which end in a, terminate in a pseudoganglion. What is the law obeyed by axillary nerve? Yes, general anatomy. It obeys the Hilton's law, right? What does the Hilton's law state? Yeah, the nerve which supplies the joint also supplies the muscles and the skin over the joint. So in axillary nerve injury, you should remember three things. Okay, the patient will not be able to abduct. No abduction possible. Second thing, the shoulder contour, right? The rounded contour of the shoulder will be lost. It will be sort of because of the deltoid atrophy. And third, remember the regimental badge of anesthesia. Three things for axillary nerve, right? Yeah, this one. Ochsner's clasping test is for which nerve? With a pointing index. Yes. He will not be able to bend the distal phalanx. Yeah. So what is the muscle responsible for flexing the digit? Yes. The flexion of, how many interphalangeal joint is that? two, right? Distal and proximal interphalangeal joint. Flexion of distal interphalangeal joint is by flexa digitorum profundus. Flexion of proximal interphalangeal joint is by flexa digitorum superficialis muscle. Okay, and index finger here, mainly your index finger. Okay, the index finger is affected. I have a picture, I'll show you. Okay, so flexa, what is the nerve? It's a hybrid muscle, right? Flexa digitorum is supplied by, yeah, the medial half of it. I'm sorry, the lateral half of it will be by the median nerve, which includes also the index finger. And the medial half of it will be by the ulnar nerve. So for index finger, this is the median nerve, right? One more, the carpal tunnel syndrome, you know, it is related to median nerve, right? So what all happens? The carpal tunnel syndrome involves all except, easy. Very good, Chudar. Yes. Okay. So the abduction is not possible. There'll be wasting of the thenar muscles, loss of cutaneous sensation over the index finger. Why there is no loss of cutaneous sensation over the thenar eminence? Because that is supplied by a recurrent branch, the palmar cutaneous branch that passes above the flexa retinaculum. Remember? Yeah, can you identify all this? So this is the hand of benediction, where you are not able to flex. Can you see? You can bend your middle finger, ring finger, but not the, I'm sorry, the little finger and the ring finger, but not the index finger and the middle finger, because the flexors are innervated by median nerve. This is Oshner clasping test, where you are not able to bend the index finger. What is this test called? The pen test. It's again for median nerve. What muscle is paralyzed? Yeah. So what is this action? He needs to abduct. This is the abduction. So if this is the thumb, this is abduction of the thumb, right? This is adduction. This is flexion and extension. So this is to test the abductor pollicis brevis. What is the nerve supply to abductor pollicis longus? Anyone? Abductor pollicis longus nerve supply? Is that abductor pollicis longus or not? Irka illaya? Chudar, Gurucharan, Shrivashni. Abductor pollicis longus is by, it's a muscle of the extensor compartment. We saw it, fourth compartment. Abductor pollicis longus and extensor pollicis brevis. Yes, no, what happened, guys? They pass through the first compartment of extensor retinaculum. This abductor pollicis longus, it will originate from your radius and ulna and insert into the carpal bones. Abductor pollicis brevis is a thenar muscle. This abductor pollicis longus will be innervated by radial nerve. Okay, that's abductor pollicis longus, but that's in the extensor compartment. Coming to the thumb, it's going to extend your thumb. Abductor pollicis brevis is a thenar muscle innervated by the median nerve. So the pen test is for median nerve injury to test abductor pollicis brevis. Okay, so this is ape thumb. The muscle paralyzed will be opponent's pollicis. Okay, the thumb is in the same plane, unable to go across the hand and touch the other digit. It's again, yeah, this is median claw. because of paralysis of first and second lumbrical. You know, the lumbrical is the one which does this, right? Flexion at the metacarpophalangeal joint and extension of the interphalangeal joint. So paralysis of it will lead to claw. So the median claw is due to paralysis of first and second lumbrical. Who's going to tell me? We'll wind up with this question, this one last image. What is this OK sign for? To test which branch of median nerve? Very good, Shrivashni. That is for the anterior interosseous nerve. You know, anterior interosseous nerve supplies the three deep muscles, flexor pollicis longus, flexor digitorum profundus, and pronator quadratus. So able to flex your thumb and flex the index finger and you make a perfect O, then your anterior interosseous nerve is normal. Okay, perfect. But when you're not able to do that, then there is an injury to the anterior interosseous nerve. Okay. Yes, guys, we'll wind up today's session. Thank you. Thank you, guys. We'll see you next week, right? Thank you. Thank you. Thank you. Good night. Good night.